Welcome back. Now we're joined now in the studio by Dr. Ruth Turk from the University of Southampton, who's come to tell us all about the development of a new wireless sleeve, which is designed to help stroke victims in their rehabilitation. Ruth, thank you very much for coming in. So this wireless sleeve, tell us a little bit first of all about what it is exactly.
This is a device that's being developed and designed for people who've had a stroke to help them with their arm recovery, the recovery of their arm movement. It's using wearable sensors that provide automatic and intelligent information about how well they're moving their arm and about how their muscle contracts. And the aim is to provide that for them while they're doing their everyday tasks, exercises that they do at home.
And in terms of stroke victims that this could be aimed at, what, I guess, level of their recovery would they be in to be able to make full use of this? And is it for sort of anyone who's been a victim of a stroke?
Yeah, we see that this is going to be most used for people in the rehabilitation phase after stroke. Increasingly, that will be in the home environment, as rehab is mostly in the home environment, or is increasingly in the home environment now. But there's no reason why it couldn't be used in a more hospital environment as well. And it's used by people who probably have moderate to mild strokes, where they are actually starting to use their arm, recover the movement in their arm. And this will help them, give them information about how well they're doing with that.
And when do you foresee it being sort of something that could be commercially available? Are you anywhere near being able to give a date on that stage yet?
Well, this is a 2-year project funded by the NIHR Invention for Innovation program. And the idea is that we're designing the device currently right now, and the project finishes in November 2017, and you know we're hoping at that stage that it's well on the way to being commercially viable.
And what inspired it for you? What pushed you, I guess, down this route of innovation?
Well, I'm actually a physiotherapist by training, but I've been an academic, and my PhD was all about how we can better measure movement problems after a stroke. But the equipment that I was using for that was very lab-based. It was something that certainly was, big and bulky and only really usable in the lab, not even in a clinical environment, let alone at home. And so we wanted to find something that could be more worthwhile using in the home environment. We talked to some colleagues of ours, some engineers at Imperial College London, who suggested the use of this device that they had been working on themselves. And together with 2 companies, Madison and Tactic, who are design companies, we together put this grant to the NIHR Eye4Eye program, and were successful in getting it.
And we've just been seeing sort of an image of the sleeve for the viewers at home. Just run us a little through about the substance it's made of, and a little bit about how it works.
The sleeve is going to be designed to be as easy as possible to put on. People need to be able to put it on themselves, or perhaps with the help of a carer. But essentially, it's going to be very lightweight. It's going to contain some sensors, 2 lots of different sensors. One is inertial measurement units. Now, these are becoming increasingly used in everyday devices such as smartphones, where they recognize the tilt of the phone and can change the orientation of the screen to vertical or horizontal. And they give us information about of the movement of the arm. And then the other sensor is a mechanomyography. It's a microphone-like sensor that gives us information about how the muscle is contracting. And together those sensors will provide, represent movement to the patient, give them an idea of how they are moving and how well their muscle is contracting. Not just for patients, but also for therapists, giving them information so that they can better assess, more accurately assess patients and have a better idea of how patients are progressing over time.
Well, Ruth, I wish you all the best in the coming 18 months of the project, and hopefully going beyond into commercial value as well.
Thank you very much.
Good luck. Thank you.
Thank you.